was a tech. Sonia solved it. The tech.
Understandable.
All right. So I'll go off camera until the supervisor arrives.
Wonderful. Thank you so much.
Thank you.
That's Thank you to everyone who has joined us so far. We will begin the briefing at 2:05 p.m. Hi, everyone. Thank you again for joining us. We have just a couple technical difficulties on our side. We'll start in just a few minutes.
Kim, can you hear me?
I can hear and see you.
Great, thank you.
Thank you. Hi, Dr. Freer.
Hey,
Supervisor Mitchell, are you ready to go?
Kim, is there any way to reach somebody in Supervisor Mitchell's office?
Yes, Dr. Freer, I have someone on the phone right now. I'll have an
Okay,
update in
perfect.
just 1 minute. Hi, Dr. Freer. I think we're going to have to go ahead and get started with your portion of the presentation, and Supervisor Mitchell will have to join after your remarks.
Okay. That sounds great.
All right, then. we'll go ahead and get started. Thank you, everyone who's joined us thus far. Today is a press briefing. It is Wednesday, December 22nd. We have Director Dr. Barbara Freer with us today and Supervisor Holly J. Mitchell, Chair of the Board of Supervisors, Holly J. Mitchell, joining us as well for her remarks. Supervisor Mitchell, thank you so much for joining us. Shall we go back to the original plan and have
Yes.
you're on mute, Supervisor, sorry.
Yes, the supervisor can get started then.
Wonderful. All right, then. Supervisor, when you are ready, please go ahead.
Thank you very much. I was having full conversation with you, Dr. Ferrer, with my mute button on, so forgive me. So good afternoon. I am Holly Mitchell, Chair of the LA County Board of Supervisors, and I represent the 2nd District. As always, I want to thank Dr. Ferrer and all of the county employees with the Department of Public Health for the work they do each and every day to keep us safe and for organizing this briefing and inviting me to join you. As you know, these weekly briefings are about providing LA County with the latest updates on COVID-19 to help keep our communities safe and informed on the facts about this dynamic, ever-changing crisis. We cannot, I emphasize, cannot do this without you, our media partners, especially our ethnic media partners. So thank you again for working with us. 2021, from my perspective, thankfully, is coming to an end and bringing us closer to the beginning of a new phase in our fight against COVID-19, with rising numbers of cases due to the Omicron variant. This may feel a little like deja vu because we certainly have been here before with the Delta variant. We have lessons learned that make us better prepared to slow the spread of this virus. We know what needs to be done. As we near the holidays, I'm asking all of us to protect ourselves and our loved ones by getting vaccinated, getting boosted, wearing our masks, and getting tested regularly. I'm sure Dr. Ferrer will talk about the in-home testing kits, when they'll be available, and who can access them as quickly as possible. But as you all know, we still have quite a ways to go. Recent county numbers show over 2 million county residents over the age of 5 are unvaccinated. 2 million of our fellow Angelenos unvaccinated. More challenging, 62% of our residents who are eligible to receive a booster have not done so. So I know that there are valid feelings of being exhausted over the mere conversation about this pandemic, because we've been through so much in these last several months, both emotional, mental, and physical. But understand, COVID-19 is not done with us, and no one should have to sacrifice their health or life when we have an important tool in our toolkit, and that's the vaccine. We still have the power to change the course of this pandemic. The efforts we're taking as individuals is how we collectively protect our communities. Getting vaccinated, getting your booster, and wearing your mask today can help us stop, at best, slow down, at the very least, the rise in cases. So I hope you all will join me in taking these actions, because as you'll recall, when COVID first hit us, we didn't have these same resources to fight back, and now we do. So getting the message out about the importance of getting vaccinated, getting your booster, wearing your mask is really important, not only for our individual safety, but really for the safety of everybody in our community. So again, Dr. Ferrer, thank you very much to the Department of Public Health and to all of the healthcare workers across the county. I want to do all that we can to help us avoid repeating history. I am confident that if we work together and do what Dr. Ferrer tells us to do, we can stop the rise in cases this holiday season. Thank you, Dr. Ferrer.
Oh, thank you so much, Supervisor Mitchell, for your extraordinary leadership and your wise counsel for all LA residents and workers. I know that I represent the millions of Angelenos that are grateful for all you continue to do to align resources and programs with ongoing and now emerging challenges. This afternoon, I'll go ahead and provide the update on the emerging science of Omicron and share what we know about our Omicron cases in LA County and how we're preparing for its threats. I'll also share our local metrics by vaccination status and by race and ethnicity, provide information on our progress with our vaccines, and explain how we're approaching contingency planning. I'll close with our recommendations on how to reduce spread during the holiday season. I'll take the first slide. Today, I'm regrettably reporting 6,500 new cases, representing more than double yesterday's case count. This steep increase, one of the steepest rises we've ever seen over the course of the pandemic, reflects the increased circulation of Omicron and the associated rapid acceleration of transmission associated with this variant. We're also reporting an additional 162 sequenced specimens testing positive for Omicron. And our test positivity has now jumped to 4.5%. Just last Thursday, test positivity was 1.9%. These numbers make it crystal clear that we're headed into a very challenging time over the holiday. If our case numbers continue to increase at a rapid pace over this week and next, we could be looking at case numbers we have never seen before, well over 20,000 cases a day by the end of the year. Although hospitalizations and deaths remain relatively stable at this time, they are both known to be lagging indicators because most people don't experience severe illness until a few days after testing positive. While many will be protected in this round against the most severe illness from Omicron because they are fully vaccinated and they're boosted where eligible, very high case numbers can easily cause significant stress to our healthcare system if even a small percent of those infected experience and require hospital care. And stress on our hospitals places all of us in a terrible position, since care can end up compromised, not just for those who are sick with COVID infection, but also those who require care for accidents, heart conditions, and cancer. I am sad to also report 16 additional deaths today. 11 of the people who passed away had underlying health conditions. And tragically, this brings the total number of deaths to 27,488 across our county. Every single death is a tragedy of unimaginable magnitude, and we extend our deepest condolences and prayers to all who have lost neighbors, coworkers, friends, and family during this difficult time. As I noted, we are reporting 6,509 new cases today. We've also reported a total now of 264 sequenced Omicron cases. The total number of cases across the county is 1,576,702. To date, almost 10 million people have been tested and had test results reported in LA County. Our daily average case rate has more than doubled since last week to 29 cases per 100,000 people. And CDC is reporting our weekly case rate has now climbed to 189 new cases per 100,000 residents, with continued very high levels of transmission across the county. There are 748 people currently hospitalized with COVID-19, and this number has remained stable for the past week. We have opened 45 new outbreaks just since Monday and have a total of 195 open investigations at residential congregate settings and non-residential settings with at least one confirmed case of COVID-19. I'll take the next slide. On this slide, you see in green the daily reported case numbers, and in orange, our 7-day daily average reported hospitalizations since October of this year. As you can see, over the past couple of days, reported cases are going up steeply. Meanwhile, our hospitalizations are holding relatively stable. This staggeringly fast rise and the healthcare system strains that has followed similarly steep increases elsewhere in the world is the cause of our alarm. Next slide. New information about Omicron is emerging rapidly. Over the past week, we've learned that immunity from past COVID infections does not effectively prevent Omicron infections. In a study conducted in the United Kingdom, the risk of reinfection with Omicron variant was 5 times the risk of reinfection with other variants. Some good news that we're hearing about the mRNA vaccines and boosters, that's Pfizer and Moderna, that they still provide some protection for preventing Omicron infections and hospitalizations. A South African study demonstrated that 2 doses of the Pfizer vaccine had 34% effectiveness at preventing Omicron infection, but receiving a booster raised that vaccine effectiveness to 75%. Another South African study showed that 2 doses of Pfizer vaccine also had 70% effectiveness at preventing Omicron hospitalizations. Early data from the United Kingdom also suggests that Omicron infections there more often result in mild illness. However, because we haven't seen sufficient information on how this variant behaves when spread among large numbers of unvaccinated and high-risk people, we need to wait to have conclusive evidence on illness severity. Because severe illness is what causes the most individual suffering and the greatest likelihood of overwhelming our healthcare systems, it is critically important information to know that vaccination and booster doses continue to make a significant difference in outcomes. Next slide. The governor announced several actions today to address the threat of the Omicron variant that will apply across the entire state. The first is a requirement that all workers at healthcare settings receive their booster doses by February 1st. The state will also provide test kits to K-12 students over the coming weeks to help facilitate testing of students as they head back to school in January. These efforts are welcomed actions and they'll make a big difference. So we appreciate the governor and our partners at the California Department of Public Health for all their support. Next slide. Our priorities for managing the oncoming winter surge of transmission haven't really changed. The number one priority is to protect the people who are most vulnerable to severe illness from COVID, and that includes our residents at skilled nursing facilities and in settings that serve people experiencing homelessness. This translates to ensuring access to vaccines, boosters, and testing for all staff and residents in these settings, requiring routine testing for staff and residents and visitors at skilled nursing facilities, and vigorously managing outbreaks and providing technical assistance at sites that serve those who are most vulnerable in our community. Our second highest priority is ensuring our hospital systems are not overwhelmed. Efforts to protect our hospital system are coordinated by the state and the Medical Health Operational Area Coordinator that's housed at DHS. And there are ongoing conversations to ensure that the entire region is prepared to manage additional cases. This winter, it's also important to ensure that all of our workers at healthcare facilities are fully boosted, given the huge advantage offered by the additional dose. And as we know from our past, if planned efforts don't succeed in keeping the hospital stable, we will need to institute additional community mitigation measures where appropriate. Next slide. There are some steps that we're taking immediately to address the threats posed by this variant. They all involve continuing our efforts to protect those most vulnerable and our healthcare system. We're aligning our health officer order today with the state requirement for workers at healthcare facilities to be up to date on COVID vaccinations, including receiving booster doses by February 1st. Additionally, we're strongly recommending that workers use higher grade masks, such as surgical masks or respirators, at locations or work sites where they're in close contact with other workers or with the public. With testing such an important strategy for keeping infected people from inadvertently spreading the virus, we began distributing 600,000 rapid test kits to residents in our hardest hit communities through a network of over 350 community organizations. And we're also redoubling efforts to vaccinate and boost residents, keeping county vaccination sites open every day this week except Christmas Day. At nursing homes, we'll be continuing the weekly testing requirement for all residents and staff. And visitors will continue to be required to have a negative test in order to enter indoor areas of nursing homes and long-term care facilities. SNFs and long-term care facilities have received rapid test kits from us to assist with these new visitor testing requirements. And we're also extending resources to settings that serve people experiencing homelessness, which includes increasing testing capacity with test kits being distributed to shelters. continuing our vaccination outreach to people experiencing homelessness, and ensuring that there is adequate PPE at all of our shelters and interim housing facilities. Next slide. We do realize that many of our residents have questions about how to make safe holiday plans, and we're focusing our communications to offer opportunities for people to ask us questions at town halls and community workshops. We've sent a public health alert to families of public school students and to clergy for sharing with their congregations, which includes safety messaging and information about the heightened risks of Omicron and what can be done to protect ourselves. We're also posting updates and educational messaging on social media platforms, urging safety and testing at holiday gatherings. Home test kits that are being distributed through community organizations all have a sticker attached, and you can see it here, letting folks know what to do if they test positive, and sharing the public health call center number where they can get questions answered and receive support with isolation and quarantine. Next slide. I do want to spend a few minutes providing updates for our on all of our other metrics. For several months now, we've been presenting case and other outcome data by vaccination status, which has generally been divided into two categories: those who are fully vaccinated and those who are not vaccinated. However, with increasing recognition that fully vaccinated people who have received booster doses have additional protection from Omicron in particular, I do want to share the data we have on case rates by three categories of vaccination status: unvaccinated, fully vaccinated without an additional dose or booster dose, and fully vaccinated with that additional or booster dose. As a reminder, high risk and older adults became eligible for booster doses on October 21st, indicated by the blue arrow. All adults became eligible on November 19th, that's that purple arrow, and teens 16 to 17 became eligible recently on December 9th. As you can see, cases have been highest and have recently begun to increase rapidly among the unvaccinated people represented by the dotted line. The rate as of December 11th was already 272 cases per 100,000 unvaccinated people. Cases among people who are fully vaccinated but haven't yet received their booster, that's represented by that dashed line, they're much lower, and they only recently began to trend upward slightly. They're reaching a rate as of December 11th of 68 new cases per 100,000 residents. Meanwhile, as you can see, the case rate amongst people fully vaccinated who also received their additional or booster dose is nearly flat at 12 new cases per 100,000 people, not much higher than it was all the way back in September. These data support other findings from around the world, suggesting that boosters offer a layer of protection that's critical to maintaining high levels of antibody defense. Next slide. Our hospitalization rates among fully vaccinated people are still too low for us to meaningfully compare people who have received additional or booster doses with those who have not. But we do continue to gather that data of all these groups, and when the numbers are high enough, we'll be able to share that. Meanwhile, this slide does still show us the differences in hospitalization rates, which are significant, between unvaccinated people, represented by the dotted line, and fully vaccinated people, represented by the solid line. While hospitalization rates reached 25 hospitalizations per 100,000 among unvaccinated people as of December 11th, they remain nearly flat at 1 hospitalization per 100,000 fully vaccinated people. This continues to be a consistent gap that we've seen between these two groups, and it indicates that even with transmission shooting upward, vaccination continues to be highly protective against hospitalization. The next slide. Death rates due to COVID generally don't increase until a few weeks after we see our case increases. So we're going to continue to follow the trends closely. But as you can see, unvaccinated individuals are 20 times more likely to die than those who are vaccinated. And while we're seeing increases in those who are unvaccinated, for those who are vaccinated, the line again has remained relatively flat for months now. Next slide. We do use these rate ratios to quantify how much greater the risk of different outcomes is in unvaccinated people compared with those who have received vaccines. This slide summarizes the case rate ratios that were assessed between December 5th and December 11th of this year. As you can see, over the course of this week, compared with this earlier week, compared with fully vaccinated people, unvaccinated people were 5 times more likely to get infected, 20 to 21 times more likely to be hospitalized, and 18 times likelier to die due to COVID infection. These greatly increased risks to unvaccinated people underpin all of our work to increase vaccination and boosters for every single resident. Next slide. When we look at who's received at least one vaccination by age and racial or ethnic group over the past year, we see that the burden of being unvaccinated continues to be shouldered unequally by different age groups and racial and ethnic subgroups. The numbers of this on this slide are color-coded, and they show subgroups among whom more than 65% have received at least one dose of vaccine, represented in white, and those with fewer than 65% vaccinated are represented in red. As you can see, the subgroups with the lowest proportions vaccinated remain among our Black and Latinx communities. Although the gaps in healthcare access to needed resources that promote health and although the gaps in access to needed resources that promote health and trust that underlie these inequities are centuries old, the threat these low numbers pose affects us all right now. Those most vulnerable to suffering the worst effects of COVID and the worst effects of Omicron or other future variants are definitely those who are unvaccinated. And where these gaps exist in vaccination coverage, we consistently see higher hospitalization and death rates. We'll take the next slide. This slide shows the hospitalization rates by racial and ethnic groups as assessed between November 28th and December 11th. Hospitalization rates were highest among Black residents during this period, with 7.2 residents hospitalized out of every 100,000 residents. And the vaccination rates, as you can see, were lowest in this very same group, with half the residents in Black communities fully vaccinated. Hospitalizations were second highest among Latinx residents at 6.4 hospitalizations per 100,000 residents, with 53% of residents in Latinx communities fully vaccinated. Hospitalization rates were less at 4.7 hospitalizations and 2.3 hospitalizations for every 100,000 white and Asian residents. These lower hospitalization rates were accompanied by vaccination rates that were higher at 67% and 76% respectively. Because hospitalizations lagged several weeks behind cases, this snapshot from late November and early December does not capture any of the fallout from the current Omicron wave. However, as this phase of the pandemic progresses, our fears are that these gaps in vaccine protection will lead to amplified gaps in severe illness, hospitalizations, and death, placing Black and Latinx residents at higher risk during this upcoming surge. Next slide. While vaccines are now available to everyone 5 and up, we continue to make slow progress in vaccination coverage across the county. As of December 19th, 97% of LA County residents 65 and over received one dose of the vaccine. 6 weeks after vaccine eligibility, 21% of children 5 to 11 received a dose of the vaccine. 80% of teens 12 to 17 have received at least one dose. And when we look at all residents 12 and over, 84% receive one dose, 76% are fully vaccinated. Among LA County residents 5 and over, 78% received at least one dose and 70% are fully vaccinated. And to date, more than 2 million LA County residents have received additional or booster doses. While these numbers are impressive and they represent tireless efforts on behalf of hundreds of vaccine providers, They leave, as Supervisor Mitchell noted, 2.2 million eligible residents that haven't yet received their first dose of vaccine, and 3.1 million residents eligible for boosters that have not yet received their additional dose. As we see these worrisome increases in cases, it's clear we urgently need to get more people to go ahead and get protected by vaccines and boosters, particularly where we're seeing gaps by geographic locations and race and ethnicity. Next slide. On this chart, you'll see first doses administered each week represented in blue, second doses in yellow, and additional booster doses in orange. Last week, we administered about 300,000 vaccinations, including 49,000 first doses, 47,000 second doses, and nearly 205,000 additional or booster doses. The number of first doses given to children aged 5 to 11 declined a little bit to almost 15,000 this past week. And this decline is not really what we'd hope to see as we go into a time where children are out of school and gathering with many others. Next slide. With cases rising nationally and here at home at staggering rates, and Omicron spreading rapidly as many of us prepare to gather for holiday celebrations, we do need to keep in mind the tools we have to protect ourselves and each other. Getting vaccinated and boosted remains the very best way to reduce the risk that you'll be infected or infect others. Getting tested before gathering, before and after travel, if you're exposed to a known or potential COVID case, or if you're sick, helps make sure you make smart decisions about whether to celebrate in person or virtually. And wearing a well-fitted medical grade mask or a respirator when you're in indoor public spaces or crowded outdoor spaces, or anytime you're near someone you know to be vulnerable to severe COVID infection, keeps you and others safe when you're intermingling with people who are infected but may not know it. The numbers clearly show that as we all prepare to enjoy the winter holidays, there is cause for concern. Our case numbers are very high, outbreaks are increasing and involving dozens and dozens of individuals. And those who have been in close contact with someone infected from COVID are testing positive themselves at very high numbers. The reality is that the vast majority of folks testing positive today are infected with Omicron, a more easily transmitted strain of the virus. While for many who are fully vaccinated and boosted, the likelihood of developing severe illness is low, there are millions in LA County at much higher risk from Omicron, including those with weakened immune systems because of advanced age or health conditions, and those not yet vaccinated, including 500,000 children under the age of 5. So I know that we're all exhausted and we're depleted by this long-lasting pandemic, but we're going to need to find our reserves and be realistic about what it'll take to get through the latest challenge as we celebrate Christmas, Kwanzaa, and the New Year. Please find ways to celebrate with as much safety as possible. When this winter break comes to an end, we want our children to be able to restart school safely, and we want our most vulnerable loved ones and friends to be healthy and safe. The best way to ensure this happens is for each of us to be smart and careful while we gather this season. I wish you a safe, peaceful, and joyous holiday, and I'm now glad to answer your questions. So along with Supervisor Mitchell, I think she might still be here. Yes. Thank you, Supervisor.
Wonderful. Glad to have you both here. If you have a question, please use the hand icon or you may chat me, the host. Our first question comes from Stephanie Dazio from the Associated Press. Stephanie, go ahead.
Hi, Dr. Ferrer. Glad to have the first question again. You talked a little bit about boosters. Is the county planning any contingency measures to require them, say like at mega outdoor events or things like that where vaccination is required? Are you adding that third as a requirement? As well as you talked about community mitigation measures if needed, and it sounds like you're hinting at the possibility of new restrictions. Can you talk a little bit more about that? Thank you.
Yes, thanks so much, Stephanie. So let's just go to the last question. I've always been transparent and honest that with a variant such as Omicron and potentially variants, other variants that could happen in the future, every single option has to be on the table. Every single tool we have needs to be available for us to protect people's lives and livelihoods, and to, in this case, avoid overwhelming the hospital care system. I do not at this point anticipate that we move into a lot more restrictions across the board. I don't think it's necessary right now because we do have these new tools that we didn't have last year. But community mitigation can involve many other strategies, including strategies that really help make sure that people are keeping masks on as much as possible at these larger mega events. We can also take a look at making sure that we're amplifying the ability of people to get testing done if they're in higher risk settings. So my sense is that we're going to do what's in front of us right now. We're going to rely heavily on getting people vaccinated and boosted, on increasing people's access to testing and using testing more widely, and keeping our masks on when we're indoors and in crowded outdoor situations. And I think if we can all do this, all of us, every single person, commit to celebrating with as much safety as possible, which may mean you're changing up some of your plans, we could be okay. We're going to see high cases, no matter what. The case numbers are going to go up, but we might be able to manage these case numbers in a way that doesn't end up stressing out our healthcare system and prevents most people from experiencing severe illness and the tragedy of passing away. And that's the goal right now. In terms of boosters, are we considering any other requirements besides the requirement to align with the state so that all of those folks who are working in healthcare settings will get boosted by February 1st? At this point, no. Again, we strongly encourage and support efforts that are being made in other sectors to make sure that people are getting boosted. I want to applaud some of the colleges and universities that are making it easy for people to come in, get that additional dose, and requiring it as a condition for returning to campus. There are these settings where it does make a lot of sense for people to go ahead and get boosted. I show data every week that continues to really just prove to all of us how powerful the booster is for people who at this point have waning protection because a lot of time has gone by from when they got their last dose. So again, pay attention to what's required at different settings, but at the county level, we're moving forward with the requirement for healthcare workers and workers in healthcare facilities. We can go on to the next question.
Thank you. The next question is going to come from Howard Bloom from the LA Times. Howard, you're unmuted. Go ahead.
Hi, thanks for taking our questions, and I hope you have a great holiday as well. So I'm curious, what questions do you have at this point, if any, about Governor Newsom's announcement regarding the distribution of 6 million rapid tests for students up and down the state? And also, I was wondering what happens as far as the LA County is concerned, or what you've heard from the state as of February 1st for those who fall under the governor's order if they have not received their full vaccine plus the booster. What happens as of February 1st? Thank you.
Yeah, thanks so much, Howard. And, I appreciate these questions as always. So we're working very closely with the state and more importantly, we're working with our school districts and the LA County Office of Education to put in place a plan for the distribution of the test kits. So there are, of course, some limited options because students are not in school right now. Many families are on vacation and staff and administrators are on vacation. But the plan is a sound one. Get kits to those families that have children that'll be returning to school, either close to the return to school or when they return to school, so we can quickly test all of the students as they come back into the school environment. It's, again, a powerful tool. We've seen it play out for the last 4 months here in LA County with really so few outbreaks because there was so much testing going on. So we're encouraged that the state has purchased these test kits. These are, of course, at-home test kits. And as many of you know, they're in short supply in many places. So we're so grateful that we have this opportunity to get these kits to families who have students in our K-12 school system. And we're going to work really hard to make sure this is possible. So I applaud the governor and the state California Department of Public Health for taking this action. I think anything we can do to amplify our testing capacity is going to be helpful with such a with a strain of the virus that's so infectious. And in terms of your second question was, Howard, remind me.
It was what happens as of February 1st to those who have not met the deadline?
Yeah, I mean, we've been here before because we already have a mandate for everybody who works in our healthcare facilities to get vaccinated, and we have super high compliance. And then each entity, has their own strategies for managing their workers who are not in compliance. But I want to applaud all of our workers who are in these healthcare facilities because the vaccination rates are super high. At our skilled nursing facilities, 97% of the workers in our most vulnerable setting are fully vaccinated. So people have done a really good job. I think we need to act with the same level of urgency on getting people boosted now. So the rates of people working in our healthcare facilities getting boosted is not as high. I think this will help remind all of us who work in healthcare settings how important it is now to go ahead and get boosted, especially because most of the workers in healthcare facilities got vaccinated, starting in December and January. So long overdue to get this additional boost to your immune system. So super important there. But I'm grateful for all of our healthcare workers because they have done a really good job of, in fact, complying with the earlier mandate. Feel very confident that we'll see the same level of high compliance with this additional request, which really is stay up to date with your vaccination schedule. We can go on to the next question. I don't know, Supervisor, did you want to chime in there?
Ditto.
Okay.
Next question is going to come from Ryan Carter from LA Daily News. Ryan, go ahead.
Hi, good afternoon, Dr. Ferrer, excuse me, and Supervisor Mitchell. Yesterday, Doctor, you pointed to, in front of Supervisor Mitchell and the board, a statewide study that showed that without interventions, this variant would overwhelm hospitals across the state. It's UC Berkeley study. Is there similar modeling going on locally for LA County? If there is no intervention, would a similar sort of flood occur at county hospitals? And then just as a sort of a second part of that, I've come across a perception out there that somehow a potentially less virulent virus could, how it could be that it could actually overwhelm hospitals. And I wondered if you could just sort of elaborate on how that could be.
Yeah, it's a great question. Thanks so much for both questions. Let me start with the latter question because I think it is top of mind for everyone. And, we'd be really grateful if, in fact, evidence continues to mount that Omicron causes less severe illness. The problem is a numbers problem. So if Omicron causes less severe illness, but it infects many more people, then even if you had a smaller number of the people who are infected get severe illness, you could still end up with overwhelming numbers. So, let's say, 3% of people who get infected end up requiring hospitalizations. but you start seeing 20,000, 25,000 cases, that 3% is still a pretty big number. That will end up being a big enough number to cause a lot of stress in the healthcare system. And we still aren't 100% certain that, in fact, Omicron causes less severe illness. So we need to pay a lot of attention, particularly to what happens among people who are unvaccinated, because here in LA County, as we noted, that's about 2 million people. So that again is a large number and can really, unfortunately, create a lot of heartache, both for families and for our hospitals. In terms of your second question on modeling for LA County, we've been, obviously there's lots of different people doing modeling. We love the Berkeley study because it focused very much on hospitalizations. Because I think we all know that the reality is case numbers are going to increase significantly. What we're trying to figure out is what's the implication of these huge increases in cases on the hospital care system, given that we have so many more people vaccinated and even a significant number of people boosted. So we appreciate it, and that's why we shared that particular modeling set of scenarios. We do work with some folks over at Johns Hopkins as well. We'll get a new model from them in early January. I anticipate it will show the same sort of relationship between potentially having cases drive these increases in hospitalizations, that with enough cases can in fact threaten the healthcare system. Their modeling is not as sophisticated to take into account sort of the gradients around reducing by 10% sort of contacts and also increasing the percent of people vaccinated and boosted. So we'll continue to work with the state numbers. They're pretty good predictors of what happens here in LA County. And then we'll take a closer look at the predictions around hospital utilization with the LA County numbers from our modelers that we get in early January.
Other piece I would add, Dr. Ferrer, as we talk about, the capacity of our healthcare systems, we also have to recognize that we are talking about a healthcare system that is already just horrifically fatigued. And so to continue to kind of push the envelope and expect that they will just stand and deliver and think that they have the same capacity, the human capacity that they did a year ago or 18 months ago, just isn't realistic.
Yeah, I totally agree. And I think it's a really important point. We have a stressed out already healthcare workforce. People have there's no breaks here. And, it's alarming what these threats mean to the workers who, give everything to take care of all of us. So.
And have done so, like you said, with no break for
2 years.
2 years. 2 years.
Right. 2 years. We can take the next question, which will probably need to be our last question today. So.
Sounds great. Our next question comes from Marla Tellez from Fox 11. Marla, you're unmuted. Go ahead.
Dr. Ferrer, Supervisor Mitchell, it's Marla Tellez. Thank you so much for taking our questions, including mine. I have, just to piggyback off of the point of being these hospital workers who are stressed out to the absolute max, emotionally, physically, mentally. I interviewed yesterday a local ICU director who was very frustrated, said that last December, he cannot believe that we're heading in that same direction as we were a year ago. Sure, we have vaccines. He made the point that last December and the months following were the worst months of his life. He says the concern, though, this season, and I want to get your take on this, Dr. Ferrer, is also flu. Respiratory illnesses are back this year, unlike last year, which was really non-existent. So I want to get your thoughts on flu adding to the stress of hospitals, and also the difference. People, there are similar symptoms as well. So thoughts on that. I also read in the LA Times your holiday plans, Dr. Ferrer. over the weekend, and I know it was going to be a small celebration outside.
It gets smaller by the minute.
That's what I'm curious. I'm curious if your plans are changing, like other people we've interviewed,
Yeah.
because of this bump up in cases in Omicron. Thank you.
Yeah, no, I appreciate your questions, Marla. Thanks so much. And you know, I just wanna extend you know, my heartfelt gratitude to all of our healthcare workers and our public health workers, you know, who really you know, can't believe that we're starting to see another huge surge right around holiday time when we all, you know, would like to, as you noted, be gathering with the people we love with a lot of safety. And I know that the frustration is very real because it just at this point seems endless. And because we have some tools that provide a lot of protection and lots of people aren't still using them, I think for those who are in charge of caring for us, the frustration can be overwhelming. Because in general, our healthcare workers, our public health workers are the most compassionate people in our county. They've dedicated themselves to caring for us when we're at our very worst. But we're asking a lot of them to take care of us when for many people that they're caring for, had they been vaccinated and or boosted, they may not have ended up needing this level of care. So I understand that frustration, and I understand the worry about flu. I want to note a couple of things: that while we do see flu this year, and we saw almost no flu last year, it's still at a very it's still a very low rate of flu. In part, that's because people are wearing those masks, and people are still doing some distancing and protecting themselves from being in large crowds with lots of other people. But children are back in school. And although we're on break now, children, unlike with COVID, where we're never, you know, children were not the drivers, children are the drivers for flu. And so again, you know, getting everybody vaccinated, you know, children 6 months and older, this vaccine has been around for eons now. So make sure it's not too late. Go ahead and get vaccinated against flu. Get your booster at the same time if you needed it. And if you still haven't gotten your first dose, this would be a good time to check in on that. So yes, we could have a flu. It could get worse. Right now, it's relatively low numbers of cases. But again, as the season goes on, you know, we're still early. Flu season usually peaks sometime in late January. So we got a ways to go, and people should continue to get vaccinated, use those masks, wash your hands a lot. And of course, you know, don't be out and about when you're sick. And yes, my holiday plans, like lots of other people, and particularly I want to note for public health workers and our healthcare workers, our plans are also up in the air because we are now needing to work. So there is a lot of work that everyone needs to do to make sure we can distribute all of these test kits. We have plans for how to get these to the families of our public school students, that we're working with our hospitals on the contingency plans and the surge plans. So for many of us, it's not just that there are some safety concerns that are becoming more prominent and the weather doesn't look so great, but it also is the reality for people in public health and in healthcare, as many of us have been called back to our jobs. And that's fine. That's, you know, what we're here for. We're here to do our jobs. But I want to note that this is a time for everyone to be really cautious and like many, you know, reassess what you're planning to do based on your risks, the risks of the people you love, and what's absolutely essential. I know that even for me, I will be with people this holiday that I wasn't able to be with last year. And I'm grateful for having more close family that I will be able to see. But it will probably remain close family at this point and not extend out. I do want to note for those of you that are fully vaccinated, fully boosted, you're taking lots of precautions, you're all getting tested. Those safety measures provide a lot of protection. So I don't want people to think that we are recommending that nobody do anything for the holidays. For those who are fully vaxxed, fully boosted, you're able to get tested before you're gathering. You're opening windows and doors if you're going to need to be inside, and you're fully ventilating. You're keeping your gatherings relatively small. I think you can go ahead and feel relatively safe. Again, nobody who's sick, has sniffles, has a cold, has a known exposure, has tested positive should be showing up to any of these gatherings.
If I might add, Dr. Ferrer, I just have to say, you know, as I sit here and listen to you, you know, I've spent really most of my entire professional career fighting for access to healthcare services based on a core fundamental belief that access to healthcare service is a right. And it's important for me to then put an and to that sentence and say, and it should not be taken for granted. And to take it for granted is to take for granted those who provide those critically important healthcare services to us. And so, you know, to pay homage to those in public health, all of our healthcare workers, the onus is upon me and all of us to protect ourselves so we don't contribute to their burden. Was proud to get my booster in one arm, my flu shot in the other arm. You know, I'm the mother of an asthmatic, and so was been consistent in getting my flu shot ever since he was born. He is now 21. And it's just become the thing to do to protect then my brand new baby with compromised lungs. And so as we talk about in the policy arena, health being a right, we have to think about those who provide those healthcare services to us and do all that we can to protect them as well.
Thank you so much, Supervisor. I also want to thank all of our media partners. You've been great. It's been a long couple of years, and we owe you all a debt of gratitude for communicating effectively with your viewers and your listeners. I also want to extend our wishes for a safe and peaceful holiday season. And we will, of course, see you next week. Supervisor Mitchell, I'll let you close us out.
I'll just say for once, Dr. Ferrer, as they ask you about your holiday plans, it's a good thing to be the only child of an only child and the mother of an only child. So my holiday gatherings are really quite tiny. That'll be a good thing for me this year. But again, wishing everyone a safe, wonderful holiday season. Wear your masks. We thank our media partners for helping us spread the message in a factual, clear way, so people understand that this isn't, that you're not talking about somebody else. It really is a very personal issue that everybody has to step up and do the right thing on behalf of the collective. Merry Christmas to everyone.
Thank you.
Thank you so much for joining us today. As Dr. Ferrer said, yes, we will be hosting a briefing next week on Thursday. If you have any questions for us about this briefing, you can send them to our media inbox, media@ph.lacounty.gov, and we will be having our Spanish remarks in just a few minutes. Thank you. Hi, Monica. Can you hear me?
Yes, I can hear you.
Okay, great. Let me flip your slides. Okay. Welcome everyone to the Spanish portion of today's briefing. Today is December 22nd. We have Monica here with us. Monica, when you're ready, you may begin.
Thank you so much. Gracias a todos por acompañarnos el día de hoy. Esta tarde proporcionaremos una actualización sobre lo que la ciencia nos dice sobre Omicron y compartiremos lo que sabemos sobre nuestros casos de Omicron en el condado de Los Ángeles y cómo nos estamos preparando para sus amenazas. También compartiremos nuestras métricas locales por estado de vacunación y por raza y etnia. Brindaremos información sobre nuestro progreso con la vacunación y explicaremos cómo estamos abordando la planificación de contingencias. Terminaremos con nuestras recomendaciones sobre cómo reducir la propagación durante las semanas de vacaciones. First slide, please. Hoy, lamentablemente, estamos informando 6.500 casos nuevos, lo que representa más del doble del recuento de casos de ayer. Este fuerte aumento, el aumento más pronunciado que jamás hayamos visto en el transcurso de la pandemia, refleja el aumento de la circulación de Omicron y la rápida aceleración del contagio asociado con esta variante. También informamos 162 muestras secuenciadas adicionales que dieron positivo por Omicron y nuestra tasa de casos positivos con base en la prueba ahora ha aumentado al 4,5%. El jueves pasado esta tasa fue de 1,9%. Estos números dejan en claro que nos dirigimos a tiempos muy desafiantes durante las vacaciones de invierno. Si nuestros números de casos continúan aumentando a un ritmo rápido, durante la próxima semana podríamos estar viendo números de casos que nunca habíamos visto, más de 20,000 casos por día a fines de este año. Aunque las hospitalizaciones y las muertes permanecen relativamente estables en este momento, se sabe que ambos son indicadores rezagados porque la mayoría de las personas no experimentan una enfermedad grave hasta unos días después de dar positivo. Si bien muchos estarán protegidos contra la enfermedad más grave de Omicron porque están completamente vacunados y han recibido el refuerzo, siempre y cuando estén en los grupos aprobados, un número muy alto de casos puede fácilmente causar un estrés significativo al sistema de atención médica si incluso un pequeño porcentaje de los infectados requiere atención hospitalaria. Nos entristece informar hoy de 16 muertes más. De estas, 11 personas tenían problemas de salud subyacentes. Esto eleva el número total de muertes a 27,488 en el condado de Los Ángeles. Cada muerte es una tragedia de magnitud inimaginable y extendemos nuestro más sentido pésame y oraciones a todos los que han perdido vecinos, compañeros de trabajo, amigos y familiares durante este momento difícil. Estamos reportando 6.509 casos nuevos hoy, el doble de casos con respecto a lo que reportamos ayer. También informamos que un total de 264 casos Omicron han sido secuenciados. Esto eleva el número total de casos en el condado de Los Ángeles a 1.576.702. A la fecha se han realizado pruebas a casi 10 millones de personas y sus resultados se han informado al condado de Los Ángeles. Nuestra tasa de casos promedio diaria se ha duplicado desde la semana pasada a 29 casos por 100,000 personas. El estimado de los CDC indica que nuestra tasa de casos semanales es de 189 casos nuevos por cada 100,000 residentes, con lo que continúa el nivel de contagio alto en todo el condado. Hay 348 personas hospitalizadas actualmente con COVID-19, una cifra que se ha mantenido estable durante la la última semana. Estamos investigando 45 brotes desde tan solo el lunes de esta semana, con un total de 195 investigaciones abiertas en entornos congregados residenciales y entornos no residenciales con al menos un caso confirmado de COVID-19. Next slide, please. En esta diapositiva puede ver en verde nuestros casos reportados diariamente y en naranja nuestro promedio diario de 7 días de hospitalizaciones reportadas desde octubre de este año. Como puede ver, durante el último día nuestros casos reportados se han duplicado. Mientras tanto, las hospitalizaciones se han mantenido estables. Este aumento asombrosamente rápido y la tensión de los sistemas de salud que ha seguido aumentos igualmente abruptos en otras partes del mundo, es la causa de nuestra alarma. Next slide, please. Está surgiendo rápidamente nueva información sobre Omicron. Durante la semana pasada nos enteramos de que la inmunidad de una infección anterior por COVID no previene eficazmente las infecciones por Omicron. En un estudio realizado en el Reino Unido, el riesgo de reinfección con la variante Omicron resultó ser 5 veces mayor que el riesgo de reinfección con otras variantes. Una buena noticia es que estamos aprendiendo que las vacunas de ARNM y los refuerzos de Pfizer y Moderna aún brindan cierta protección para prevenir la infección y la hospitalización por Omicron. Un estudio sudafricano demostró que 2 dosis de la vacuna Pfizer tenían un 34% de efectividad para prevenir la infección por Omicron y que recibir un refuerzo aumentó la efectividad de la vacuna al 75%. Otro estudio sudafricano mostró que 2 dosis de la vacuna Pfizer también tenían un 70% de efectividad en la prevención de hospitalizaciones por Omicron. Los primeros datos del Reino Unido sugieren que las infecciones por Omicron allí con mayor frecuencia resultan en una enfermedad leve. Sin embargo, todavía no hemos visto suficiente información sobre cómo se comporta esta variante cuando se propaga entre un gran número de personas no vacunadas y de alto riesgo. Debido a que la enfermedad grave es lo que causa el mayor sufrimiento individual y la mayor probabilidad de abrumar nuestros sistemas de atención médica, es de vital importancia conocer si la vacunación y la dosis de refuerzo continúan marcando una diferencia significativa en los resultados. Next slide, please. El gobernador anunció hoy varias acciones para abordar la amenaza de la variante Omicron que se aplican a todo el estado. El primero es un requisito de que todos los trabajadores en los entornos de atención médica reciban dosis de refuerzo antes del 1 de febrero. El Estado también proporcionará juegos de pruebas a los estudiantes de kinder a grado 12 durante las próximas semanas para ayudar a facilitar que los estudiantes se hagan la prueba antes de regresar a la escuela en enero. Estas son acciones bienvenidas que marcarán la diferencia y agradecemos al gobernador y a nuestros socios en el Departamento de Salud Pública de California por todo su apoyo. Next slide, please. Nuestras prioridades para manejar la inminente oleada de contagio invernal no han cambiado. Nuestra prioridad número 1 es proteger de enfermedades graves por COVID a las personas que son más vulnerables, que incluye a los residentes en los centros de enfermería especializada y de entornos que atienden a personas sin hogar. Esto se traduce a garantizar el acceso a vacunas, refuerzos y pruebas para todo el personal y los residentes en estos entornos, requerir al personal, los residentes y los visitantes hacerse pruebas de rutina, manejar enérgicamente los brotes y prestar la asistencia técnica en los sitios que atienden a las personas que son más vulnerables en nuestras comunidades. Nuestra segunda prioridad, además, más alta, es garantizar que nuestros sistemas hospitalarios no se vean abrumados. Los esfuerzos para proteger nuestro sistema hospitalario son coordinados por el Estado y el coordinador del área operativa de salud médica, y hay conversaciones en curso para garantizar que toda la región esté preparada para manejar casos adicionales. Este invierno también es importante asegurarse de que los trabajadores del sector salud reciban la vacuna de refuerzo, dada la gran ventaja que ofrece esta dosis adicional. Como hemos aprendido en el pasado, si los esfuerzos planeados no logran mantener a los hospitales estables, es posible que cuando sea apropiado debemos implementar medidas de mitigación adicionales en la comunidad. Next slide, please. Para abordar las amenazas planteadas por esta variante, el condado continuará con todos los esfuerzos para proteger a los más vulnerables y a nuestro sistema de atención médica. Estamos alineando nuestra orden del funcionario de salud con el requisito estatal de que los trabajadores de los centros de atención médica estén al día con las vacunas de COVID, incluido el recibir la dosis de refuerzo para el 1 de febrero del 2022. Además, es altamente recomendable que los trabajadores usen mascarillas de grado superior como mascarillas quirúrgicas o respiradores en sitios o lugares de trabajo donde están en estrecho contacto con otros trabajadores o el público. Siendo la prueba una estrategia tan importante para evitar que las personas infectadas propaguen el virus sin querer, comenzamos a distribuir 600,000 pruebas rápidas a los residentes de nuestras comunidades más afectadas a través de una red de más de 350 organizaciones comunitarias. Y estamos redoblando nuestros esfuerzos para vacunar y estimular a los residentes, manteniendo abiertos los sitios de vacunación del condado todos los días de la semana, excepto el día de Navidad. En los hogares de ancianos, continuaremos con el requisito de pruebas semanales para todos los residentes y el personal. Se seguirá requiriendo que los visitantes tengan una prueba negativa para ingresar a las áreas interiores de los hogares de ancianos y las instalaciones de atención a largo plazo, así como los centros de enfermería especializada han recibido pruebas rápidas de nuestra parte para ayudarlos a cumplir con los nuevos requisitos de prueba para los visitantes. También estamos extendiendo recursos a entornos que atienden a personas sin hogar, lo que incluye aumentar la capacidad de que las personas se hagan la prueba al distribuir juegos de prueba en los refugios, continuar nuestro alcance de vacunación a las personas sin hogar y garantizar un buen acceso a equipo de protección personal en refugios y viviendas provisionales. Next slide, please. Nos damos cuenta de que muchos de nuestros residentes tienen preguntas sobre cómo hacer planes para disfrutar de las festividades con seguridad y estamos enfocando nuestras comunicaciones para ofrecerles oportunidades para hacernos preguntas en las reuniones del ayuntamiento y en talleres comunitarios. Hemos enviado una alerta de salud pública a las familias de los estudiantes de escuelas públicas y al clero para que la compartan con sus congregaciones, que incluye mensajes de seguridad e información sobre los mayores riesgos de Omicron y lo que se puede hacer para protegerse. También estamos publicando actualizaciones y mensajes educativos en las plataformas de redes sociales que instan a tomar medidas de seguridad y hacerse la prueba en las reuniones navideñas. Los juegos de pruebas caseras que se distribuyen a través de organizaciones comunitarias tienen una etiqueta adjunta que les permite a las personas saber qué hacer si obtienen resultados positivos y comparten el Centro de Atención Telefónica de Salud Pública, donde pueden obtener respuestas a sus preguntas y recibir apoyo en caso de aislamiento y cuarentena. Next slide, please. Queremos dedicar unos minutos también a proporcionar actualizaciones sobre nuestras métricas. Desde hace varios meses hemos estado presentando datos de casos y otros resultados por estado de vacunación que generalmente hemos dividido en dos categorías: completamente vacunados y no vacunados. Sin embargo, con el reconocimiento cada vez mayor de que las personas completamente vacunadas que han recibido dosis de refuerzo gozan, en particular, de una protección adicional contra Omicron, nos gustaría compartir los datos que tenemos sobre las tasas de casos por tres categorías de estado de vacunación: no vacunados, completamente vacunados sin la tercera dosis adicional o la dosis de refuerzo, y completamente vacunado con una tercera dosis adicional o de refuerzo. Como recordatorio, los adultos mayores y de alto riesgo fueron aprobados el 21 de octubre para recibir la vacuna de refuerzo indicado por la flecha azul, mientras que los adultos fueron aprobados el 19 de noviembre indicado por la flecha púrpura. Y los adolescentes de 16 y 17 años fueron autorizados el 9 de diciembre. Como puede ver, los casos han sido más altos y recientemente han comenzado a aumentar rápidamente entre las personas no vacunadas representadas por la línea de puntos, alcanzando una tasa de 272 casos por cada 100,000 personas no vacunadas al 11 de diciembre. Los casos entre las personas que están completamente vacunadas pero que aún no han recibido refuerzos representados por la línea discontinua fueron mucho más bajos y solo recientemente comenzaron a tener una tendencia levemente ascendente, alcanzando una tasa de 68 casos por 100,000. Mientras tanto, la tasa de casos entre las personas completamente vacunadas que también han recibido una dosis adicional o de refuerzo es casi plana en 12, no mucho más alta que en septiembre. Estos datos respaldan otros hallazgos de todo el mundo que sugieren que los refuerzos ofrecen una capa de protección que es fundamental para mantener altos los niveles de defensa de anticuerpos. Next slide, please. Nuestras tasas de hospitalización entre las personas completamente vacunadas siguen siendo demasiado bajas para que podamos comparar de manera significativa a las personas que han recibido dosis adicionales o de refuerzo con aquellas que no las han recibido. Continuaremos recopilando datos sobre sobre cada uno de estos grupos, pero mientras tanto, esta diapositiva nos muestra las diferencias en las tasas de hospitalización entre las personas no vacunadas, aquí representada por la línea de puntos, y las personas completamente vacunadas, aquí representada por la línea continua. Si bien las tasas de hospitalización alcanzaron 25 por 100,000 entre las personas no vacunadas, se mantuvieron casi sin cambios en una de cada 100,000 personas completamente vacunadas. Sigue habiendo una brecha constante entre estos dos grupos, lo que indica que incluso con el contagio disparando hacia arriba, la vacunación continúa brindando un alto grado de protección contra la hospitalización. Next slide, please. Las tasas de mortalidad debido al COVID generalmente no aumentan tras unas pocas semanas después de que vemos aumentar los casos. Por lo tanto, continuaremos siguiendo de cerca estas tendencias. Como puede ver, las personas no vacunadas tienen 20 veces más probabilidades de morir que las vacunadas. Next slide, please. Usamos índices de tasas para cuantificar cuánto mayor es el riesgo de diferentes resultados en personas no vacunadas en comparación con aquellas que han recibido las vacunas. Esta diapositiva resume las tasas de casos observadas entre el 5 y el 11 de diciembre de este año. Como puede ver, en el transcurso de esta semana, en comparación con las personas completamente vacunadas, las personas no vacunadas tenían 5 veces más probabilidades de infectarse, 21 veces más probabilidades de ser hospitalizadas y 18 veces más probabilidades de morir debido a la infección por COVID. Estos riesgos, mucho mayores para las personas no vacunadas, sustentan todo nuestro trabajo para aumentar la vacunación y los refuerzos entre todos nuestros residentes. Next slide, please. Mirando más ampliamente por edad y grupo racial o étnico, ¿quién ha recibido al menos una vacuna durante el año pasado? Vemos que la carga de no estar vacunado continúa siendo asumida de manera desigual por diferentes grupos de edad y subgrupos raciales y étnicos. Los números de esta diapositiva están codificados por colores para mostrar los subgrupos entre los cuales más del 65% han recibido al menos una dosis de la vacuna, aquí representada en blanco, y aquellos con menos del 65% vacunados, aquí representados en rojo. Como puede ver, los subgrupos con las proporciones más bajas de vacunados siguen siendo nuestras comunidades afroamericanas y latinas. Aunque las brechas en el acceso a la atención médica y a los recursos necesarios para promover la salud y la confianza que subyacen a estas desigualdades tienen siglos de antigüedad, la amenaza que representan estos números bajos nos afecta a todos en este momento. Los más vulnerables a sufrir los peores efectos de Omicron u otras variantes futuras son aquellos que no están vacunados y donde existen estas brechas en la cobertura de vacunación. Constantemente vemos las tasas más altas de hospitalización y muerte. Next slide, please. Esta diapositiva muestra las tasas de hospitalización entre residentes por grupo racial y étnico evaluadas entre el 28 de noviembre y el 11 de diciembre. Como puede ver, las tasas de hospitalización fueron más altas entre los residentes afroamericanos durante este periodo, con 7,2 de cada 100,000 residentes hospitalizados, y las tasas de vacunación fueron más bajas, con aproximadamente la mitad de los residentes de las comunidades afroamericanas completamente vacunadas. Las hospitalizaciones fueron las segundas más altas entre los residentes latinos, con 6,4 por 100,000, con el 53% de los residentes en las comunidades latinas completamente vacunados. Las tasas de hospitalización fueron solo 4,7 y 2,3 por cada 100,000 residentes blancos y asiáticos. Estas tasas de vacunación más bajas estuvieron acompañadas de tasas de vacunación que fueron más altas, el 67% y el 76% respectivamente. Debido a que las hospitalizaciones se dan varias semanas después de que se presentan los casos, esta imagen de finales de noviembre y principios de diciembre no captura las consecuencias de la oleada actual de Omicron. Sin embargo, a medida que avanza esta fase de la pandemia, nuestros temores son que estas brechas en la protección de la vacuna conduzcan a brechas aún más grandes en cuanto a enfermedades graves, hospitalizaciones y muertes, colocando a los residentes afroamericanos y latinos en mayor riesgo durante este aumento repentino. Next slide, please. Con las vacunas ahora disponibles para todas las personas de 5 años en adelante, continuamos avanzando en la cobertura de vacunación en todo el condado. Al 19 de diciembre, el 97% de los residentes del condado de Los Ángeles de 65 años o más habían recibido al menos una dosis de la vacuna. Después de aproximadamente 6 semanas de aprobarse la vacuna, el 21% de los niños de 5 a 11 años han recibido una dosis. El 80% de los adolescentes de 12 a 17 años han recibido al menos una dosis, y cuando miramos a todos los residentes de 12 años o más, el 84% ha recibido una dosis y el 76% están completamente vacunados. Entre los residentes del condado de Los Ángeles de 5 años o más, el 78% ha recibido al menos una dosis y el 70% está completamente vacunado. Y hasta la fecha, más de 2 millones de residentes del condado de Los Ángeles han recibido dosis adicionales o de refuerzo. Si bien estos números son impresionantes y representan los esfuerzos incansables de cientos de proveedores de vacunas, hay aproximadamente 2,2 millones de residentes aprobados que aún no han recibido su primera dosis de la vacuna, y 3,1 millones de residentes aprobados para recibir el refuerzo que aún no han recibido su dosis adicional. A medida que vemos estos preocupantes aumentos en los casos, está claro que necesitamos con urgencia proteger a más personas con vacunas y refuerzos, particularmente donde seguimos viendo brechas por ubicación geográfica y raza y etnia. Next slide, please. En este cuadro, las primeras dosis administradas cada semana están representadas en azul, mientras que las segundas dosis están en amarillo y las dosis adicionales o de refuerzo están en naranja. La semana pasada administramos alrededor de 300,000 vacunas, incluidas 49,000 primeras dosis, a 47,000 segundas dosis y casi 205,000 dosis adicionales o de refuerzo. El número de primeras dosis administradas a niños de 5 a 11 años disminuyó levemente a 14.793 esta semana y la disminución no es lo que realmente necesitamos ver a medida que nos adentramos en un momento en que los niños no van a la escuela y se reúnen con otros. Next slide, please. Dado que, a nivel nacional y local los casos aumentan a un ritmo asombroso y Omicron se propaga rápidamente a medida que muchos de nosotros nos preparamos para reunirnos para las celebraciones navideñas, debemos tener en cuenta las herramientas que tenemos para protegernos a nosotros mismos y a los demás. Vacunarse y reforzarse sigue siendo la mejor manera de reducir el riesgo de que usted se infecte o infecte a otras personas. Hacerse la prueba antes de la reunión, antes y después del viaje, si está expuesto a un caso conocido o potencial de COVID o si está enfermo, lo ayuda a tomar decisiones inteligentes sobre si celebrar en persona o virtualmente. Y usar una mascarilla de grado médico bien ajustada o un respirador cuando se encuentra en espacios públicos interiores o espacios al aire libre concurridos o en cualquier momento que esté cerca de alguien que sabe que es vulnerable a una infección grave por COVID, lo mantiene a usted y a otras personas a salvo cuando se mezcle con personas que están infectadas pero que quizá aún no lo sepan. Los números son claros y a medida que nos preparamos para disfrutar de las festividades de invierno, hay un motivo de preocupación. Nuestro número de casos es muy alto, los brotes están aumentando e involucran a decenas y decenas de personas y aquellos que han estado en contacto cercano con alguien infectado con COVID están dando positivo en números muy altos. Y la realidad es que la gran mayoría de las personas que dan positivo en la actualidad están infectadas con Omicron, una cepa del virus que se contagia más fácilmente. Si bien para muchos de los que están completamente vacunados y han recibido la dosis de refuerzo, la probabilidad de desarrollar una enfermedad grave es baja, hay millones con un riesgo mucho mayor de adquirir Omicron, incluidos los que tienen el sistema inmune débil debido a la edad avanzada o a su estado de salud, y los que aún no han sido vacunados, incluidos 500,000 niños menores de 5 años. Entonces, aunque estamos agotados por esta pandemia de larga duración, necesitamos encontrar nuestras reservas y ser realistas sobre lo que se necesita para superar este último desafío mientras celebramos la Navidad, el Kwanzaa y el Año Nuevo. Por favor, encuentren formas de celebrar con la mayor seguridad posible. Cuando estas vacaciones de invierno lleguen a su fin, queremos que nuestros hijos puedan reiniciar la escuela de manera segura y queremos que nuestros seres queridos y amigos más vulnerables estén sanos y seguros. Una forma de garantizar que esto suceda es que cada uno de nosotros sea inteligente y cuidadoso mientras nos reunimos durante estas festividades. Les deseamos unas fiestas seguras, tranquilas y felices. Muchas gracias.
Thank you so much, Monica. And thank you to everyone who's joined us today. As a reminder, we will be hosting a briefing next week on Thursday. And if you have any questions, please send them to our media inbox at media@ph.lacounty.gov. Thank you again and happy holidays.